Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Hello, and welcome to another episode of Empowering Your Plan with the Phia Group. I'm your co-host, Adam Russo. With me, as always, is the amazing, handsome, not really impressed with the shirt he's wearing today, but anyways, what's your title again?
I am Executive Vice President
I keep forgetting that.
General Counsel and Senior Legal Associate and I don't know, I give up.
And just the man, Ron E. Peck. Say hello, Ron.
Hello, Ron.
And Ron, it's just the two of us today, but as always, we have the great, the infamous Patrick Santos. Say hello, Pat.
Hello, Pat.
Folks, today's podcast is probably the most important podcast we've ever done. It's the most proud podcast we've ever done. It's something that Ron knows I've wanted for years here at Phia Group. And finally, at a holiday party in front of about 240 people, we made a huge announcement. It was great for me to be able to stand up in front of all these folks and their families and significant loved ones and tell them that if you've been at the Phia Group for a certain amount of time, your health care is free. Not just free for that employee, but free for that employee and all their dependents, their wife, their kids, their adopted kids, their stepkids. Whoever's on the plan, we will make sure that they have no out-of-pocket costs. So people are like, oh, that means there's a deductible. No. No deductible, no premium. You get access to our amazing health plan if you've been here for 5 years or longer at no cost to you.
And I think it's worth noting also, people asked about, well, what about copays? And there are some copays on the plan, but most people don't pay them. Because the copays, and we've talked about this in previous podcasts, the copays are increased for services that are really not necessary and are high cost and eliminated for the low cost options like walk-in clinics, direct primary care, generic medication.
And we're going to go over all that, Ron, right? But the number one thing people always ask us now is, well, how do you do that? Folks, you have to understand, across the country, premiums are going up. Employee contributions are going up. Deductibles are going up. Copays are going up. Out-of-pockets are going up. Except here. Everywhere else it's happening. Here, even if you haven't been on our plan for 5 years, guess what? Your premiums aren't going up. We've kept them the same as last year. No increase in premiums. And our premiums are already low for those employees. But people always ask, how can you do it? It's pretty simple. We've designed a plan. I say it's simple, but it's complicated. But for us, if you follow the process, it's simple. It starts with plan design. Then it starts with incentive programs. And then the hardest part of the simple process is turning these employees, not just into patients of healthcare, but into consumers of healthcare. That is a number one differentiator. We actually have our employees realize that having access to health insurance or a provider is no different than deciding what television you want to buy. You can look up quality metrics. You can actually see what the costs are. You can make a consumer-driven choice as to what's best for you, your body, and your family, and your pocketbook.
It's amazing to think, Adam, and you keep using the word simple, simple, simple. And I think it's one of those things where from the outside looking in, it seems so complex. But when you actually get there, you look back on where you've been and say, that was a lot easier than I thought it would be. One, your commentary about the plan participants and their families being consumers of healthcare. People ask, well, what does that mean? And one of the things that I think is driving the rising out-of-pockets, the rising costs that you were talking about, is the fact that when you look at healthcare, the consumer of healthcare is not, or at least they don't view themselves as, the payer of healthcare. All the time, even us in the industry, when we refer to the payer, we're talking about the plan sponsor being the employer or the third-party administrator, even an insurance carrier, right? But where's that money coming from? Eventually, it trickles down to the policyholders or the plan's employees, the plan members. So one of the first things we did was show our employees how health insurance works and the fact that when these health plans have to pay more for health care, eventually that cost trickles back to them. And that's why it behooves them to keep those costs down, because that means less cost trickling down to them.
At the end of the day, folks, there are so few companies nationwide that actually do this. I think we researched it. We found 8 companies that actually offer free healthcare to their employees. It boggles my mind when I think about it. For years, this was our dream. It took a long time to get everyone basically educated as to where they need to be. But folks, to give you an example of how this is done, it's not as simple as, it's a PR stunt where we sit there and go, hey folks, we're going to give everyone free healthcare. And we know, all right, it's going to cost us $700,000, but we're going to get a lot of good publicity for it. No, we built workshops. We designed a plan. We designed incentive programs. And I want to go over those, Ron. I want to make sure we talk to people about this because it's really important. one of the key things that people have to realize is in order to do this, you have to make sure that every incentive program, every cost containment program, every quality metric is understood by every single employee. So these workshops we have with our employees are mandatory. To me, a workshop on our healthcare plan is no different than training you on your job.
Sure. I mean, if I'm losing money or making money on behalf of the company, we all rise or fall with the tide.
So one of the first things we tell our employees is you have access to direct primary care, right? Dr. Tremblay, Action Medicine, 5 miles down the road. Why is that important, Ron?
Well, I mean, again, if you tell someone they have direct primary care, what are they going to think? They go, oh, that's nice, that's nice. Do you know what direct primary care is? Do you know what difference it's going to make to you and your family? So it's important, one, because our direct primary care physician, Dr. Tremblay, he acts as an air traffic controller for the plan. He's not only delivering primary care to our employees, but if those employees need a specialist, they need a scan, they need something that he can't do at his office, he can help them identify the highest quality, lowest cost option for them. So he's helping the employee and helping us as an air traffic controller. And two, frankly, I've had a lot of primary care physicians in my life. He's an excellent doctor. I've never been in better health in my life. So keeping me healthy, frankly, by giving me the time.
Make sure you don't cough during this podcast,
I'm
Ron.
doing the best I can. Time, attention that he pays to me pays off in the form of better health. And better health means lower health costs.
Bingo. Next, we make sure that every employee knows that they will get $100 just to talk to our HR department before they have any medical procedures done.
She's never been so popular.
Right.
I wish somebody would pay someone to be my friend.
Why do we do that? Because when we give people alternatives, when we tell them, and this ties into a couple of different vendors that we're going to be working with in this. We tell our people, okay, here's the app. Go on the app. Look up the doctor that you want to go to. How good is that doctor? What's his infection rate? What's his readmission rate? Oh, by the way, he's going to cost the plan $45,000. Do you realize there's another doctor closer to your house with a lower readmission rate, a lower infection rate, higher quality outcomes, and cost $10,000? It's going to save the plan $30,000. You get 20% of that.
You know what's funny? Somebody actually asked me about that because I told them about the whole quality metric and how important quality transparency is to us. In fact, I think it's as important, if not more so, than price transparency.
It is.
And the
But
response
no one talks
I got,
about it.
The response I got was, yeah, but what if the better quality provider costs more? Aren't you then steering the person to a more costly physician? I said, do you know how costly sepsis is? Are you kidding me? Trust me, you're going to eat up those savings day one if there's a complication. Again, that long-term vision, it's not just one event. It's a chain of events that leads into the future.
But in our industry, all people talk about is cost. They don't focus on quality. So what's next? We talk about the diapers and wipes program. So obviously, as everyone knows, we've been talking about it for years. We give here at Phia free diapers and wipes for 1 year to any woman who delivers a child at one of the pre-selected hospitals.
Sure. Centers of excellence.
Centers of excellence, high quality, low cost facilities. We go over that. We talk about the alternatives with specialty drugs and just normal prescription drugs and how we can use another vendor that we work with using their app to see if there are lower cost, better quality prescriptions available to you that your doctor would say, yeah, do it.
So one of the things I think the keys to success, Adam, is that people have to understand how to use these programs in their real life. So the thing is, you can explain to someone at a very sort of high level, this is what it is, this is what it does. But when you can actually give them a real example, Jimmy, you have the flu. You need to see a doctor. Who do you call? After you see the doctor, they say you need this medication. Do you just fill it at the closest pharmacy or do you XYZ? Walking people through an actual case study or example helps them digest it and understand what they need to do when it impacts them. That's one. Two is testimonials. The employees at the Phia Group have gone through these things and not only saved money for themselves and for the company, but actually experienced better outcomes.
Right.
We have an employee, high ranking, who has had 2 babies. One was before the diapers and wipes program, one after. She honestly, candidly admitted that in hindsight, she is glad for it even if she hadn't gotten free diapers and wipes because the facility to which we sent her, A, the parking was free, which if you live in
Not
Boston,
valet
you know,
parking.
that's big time, right?
That's
One,
huge.
free parking. 2, the room was nicer. The equipment was newer. The doctors, the providers were nicer. They had more time to spend on her. The actual experience itself, to the quality metrics portion, was in and of itself worth it. The diapers and wipes, icing on the cake.
And it saved the plan $20,000.
Easy peasy.
So in addition to that, we talk about urgent care, how we want you to go to urgent care if at all possible. If it's not an emergency situation, either urgent care or go to your DPC doctor, Dr. Tremblay.
Our TPA went through our claims data, Adam, and they were able to determine that we had 0 inappropriate ER visits. Literally in the 100th percentile, not only for their book of business, but for the entire nation. There is always going to be at least that one person who goes to the
have
ER
Phia
for a
employees.
flu shot.
We have
not
Phia,
us.
We have Phia employees in front of every ER, just making sure that none of our people
Don't
go
in there unless it's okay.
I want to see that broken leg. Oh, you can get that fixed at an urgent care facility.
It's amazing because we take it for granted, I think, that we know what urgent care is. We know
Right.
what a walk-in clinic is. We know what a PCP or direct primary care is and which physician or which provider is correct for which issue. Many people don't realize that this happens or that happens, I should go here versus there. The knee-jerk reaction is, if it's not a sniffle, go to the ER.
Oh, trust me, I have a best friend. Anytime something happens to his kid, he's like, emergency room. I'm like, dude, what are you doing? It's a bump on the kid's head. Yeah, but what if that's, first off, you just call your doctor. What do you mean call my doctor? I'm like, you can't call your doctor, do a FaceTime visit with your doctor? No.
Oh, now we're going back to the DPC, the conversation,
Exactly.
huh?
But the most important thing that we started this whole thing off with is our old school approach, where we literally told our employees, we will do a claim audit review program. If you find something wrong with your bill, if you find something on your bill that we don't have to pay because it never happened, an overpayment, whatever, you will get 20% of the savings on whatever you identify.
What's that smell? You know what? I smell passion for Subro, Adam. Still working its way in.
That's how it all started. And we used that program tied into all the other things that we do. And it has allowed me to have the dream come true where we're able to offer our employees free healthcare here at the Phia Group, which is huge. Now, if people think, why do you do that? Well, a couple reasons. One, we already had a great health plan, so why would you make it no cost? Why? Retention, recruitment. It's an employee benefit. I want our employees who've been here to know that they're cared for. I want the employees who've been here for a while to know that they're important to me. They're important to our company. They're not just some cog. They bring something of quality to this company, is the reason why this company is so successful, the reason why we continue to grow, the reason why we continue to thrive. These folks, because they are following the plan, because they are doing everything possible to empower our plan, empower themselves, have better health care, better quality outcomes for themselves and their families. Because of that, your health care is free. But you have to follow the program. So every one of these employees, every one of our employees, we do the workshop, they sign a checklist acknowledging it. Folks, think about it. Once a year at your company, you do a fire drill. Again, it's a fake fire. Everyone has to go out the exits. You go outside. Great. You did it in 3 minutes. All right. Only 5 people burned. Fine. Perfect. Like the last fire drill, I think I stayed in the bathroom, actually, Ron.
We had a couple people go outside, take a smoke break,
Yeah.
Good opportunity.
It ties in, right?
There you go.
Perfect.
Fire.
But people spend more time doing a fire drill than they do on going over the health benefits, looking at opportunities for incentive programs, cost containment programs. Folks, to be quite honest, nobody does this stuff. We've been talking about it for years, and it's still a very small percentage of our clients and non-clients who do any of these types of programs for their employees.
I'm really glad you bring that up, Adam, because it reminds me of one of the slides that I've seen in your presentations. And I really like this slide. It's the one where you show that in order to get, a $10,000 raise, an employee has to go through all of these steps. But to get a $100,000 medical bill paid, you just submit the bill and it gets paid, and you don't go through any steps. And how, from a profit and revenue perspective and a cost perspective as an employer, one's coming out of my right pocket, one's coming out of my left pocket, but it's still the same pair of pants. Why is one such a priority and the other not? And it ties into what you just said, because here's the thing. If I'm an employer and the Phia Group's telling me, oh yeah, we're going to be giving health benefit coverage away for free to our employees who've been on the plan for XYZ years. Other employees, their contributions haven't gone up in 10 years. Co-pays are gone, deductibles are gone. They're going to say, man, you guys are blowing all that money. You know what makes me crazy? If you get a bunch of employees and they're not happy and they're ready to leave, the knee-jerk reaction is to do what? Increase their salary, increase their pay, right? We're going to keep them on with bonuses and with salary. And what does a person do with that salary? They go home, they pay their mortgage, right? They pay for their car, they pay for food, they pay for entertainment. As an employer, do you have any control over the cost of those things? The cost of someone's car, the cost of someone's home, the cost of their entertainment? No.
But they ask for a raise.
But they ask for a raise to pay for those things. And
Right.
what do? You cut a check. You cut a check. And as those costs go up, you keep cutting checks. Imagine if you could impact the cost of their car. Imagine if you could impact the cost of their home and bring those costs down. They wouldn't ask for a raise.
Right, but you can never do that, Ron.
No.
That's impossible.
But you could with
But you
healthcare.
could with healthcare.
But nobody does.
And that's why we're here. Folks, if you're interested in finding ways to do this, please contact Ron or myself. I mean, this is, to me, the most proud achievement that we have at Phia in the 20 years of this company's existence. By the way, our 20th anniversary is happening in February. We're really excited about that. But folks, remember this. It costs $26,000 to recruit, hire, and train an employee. $26,000. If you're able to have these fine employees who are loyal to you, who are good employees, who help make your company profitable, and you put these things in place and they follow the plan, they do the right cost containment measures, they use the applications at hand, they look at the quality metrics, they look at the overall cost of the plan, you'll be able to do exactly what we're going to do for your employees. And that way, instead of treating health benefits and health expenses as something that you cannot control, just like you cannot control the car that someone's going to buy, you are able to make a significant difference to a person's life. Because sure, maybe you can't give them a $5,000 raise. You can give them a $2,000 raise this year. But guess what? You can make it that their deductible is $0 and not $5,000. Make their copay $20 or $0, not $100.
Addition by subtraction.
When you have people's copay no different for an emergency room or an urgent care facility, what incentive do they have to not go to the emergency room? None. You have to give your people a reason to actually care about the cost. But right now, most employers, Ron, don't care about the cost because they think there's nothing they could do about it. So that's the message for today. We're really proud of this. Again, no premium. Our employees who are on the plan for a certain period of time have no premium at all. Get free health insurance here at the Phia Group. Ron, final thoughts.
Thank you very much, Adam. On behalf of myself and my family, I appreciate it very much.
Well, Ron, I didn't tell you that you're actually going to have to pay. You have to pay for all the other people
I'm
who
paying
aren't
for
paying.
everybody else, but for mine, it's free. So thank you.
Folks, I hope you enjoyed this podcast. On behalf of Pat Santos, our amazing producer, Ron Peck, my amazing sidekick, and your co-host with the most, Adam V. Russo, Esquire, the CEO here at the Phia Group, thank you for empowering your plans with the Phia Group. Have a great day.